Hello everyone, this is Tom Stanley, your state representative and city councilor. This is the Stanley Report, a show where I bring state government and local government to the residents of Waltham. We talk about how our tax dollars are being spent wisely. Today I'm very honored to have as a guest the Secretary of Human Services, Marylou Sudders. Good afternoon.
Thank you. Thank you for having me.
Thank you very much. We've known each other for a while. When I first became state representative in 2001, or right around 2002, 2003, you were the Commissioner of Mental Health, right?
That's correct, yes.
And as we were chatting, so at that time, I think you were involved with, in some degree, I believe, correct me if I'm wrong, the closing of the Waltham Hospital issue, and then as we were chatting, you were explaining to me that you were the last superintendent of the Metropolitan State Hospital.
Yeah.
And you also, as a young adult, a couple of years ago, you in college, or just out of college, you were doing some work at the Fernald School, right?
Yes, that's
so
right.
So you have a lot of history.
I have roots in Waltham.
Roots in Waltham. And I won't say where, but you're taking dance lessons in the city of Waltham, right?
That's correct.
I think that's safe to say. So you've been appointed Secretary of the Executive Office of Health and Human Services by Governor Baker in January 2015. And it's the second largest state agency, is that correct?
No, I'm the largest state agency.
The largest.
This is what half a state government looks like.
Wow. Yeah, it is a lot of responsibility.
Yes.
And so we're here to just talk about your role, and maybe we could start out with talking a little bit about your background prior to this position, and maybe you could speak to how all the different roles that you have played have helped you to prepare for this position.
Yeah. Well, thank you. It's always good to see you, and I'm pleased to. It's a pleasure to be back in the Commonwealth of Massachusetts. As you said, so let me go back. Don't worry, I won't do my entire history in 30 years, in 30 minutes or less. My love of public service actually goes back to my social work training and at the Fernald State School, my first year of graduate school in social work. And then I went across the street to Metropolitan State Hospital to finish my social work training. So I provided home visiting in some of the public housing in Waltham in the late 1970s as a social work student, and then helped individuals who were at Metropolitan State Hospital move from the state hospital to the first community residence out in Concord, Massachusetts as a graduate student. But more important, that really sowed my roots and incredible belief in public service, helping some of our most vulnerable citizens. You know, Waltham is not is a community I'm really quite comfortable in, both from my social work training to being the last superintendent of Metropolitan State Hospital, to overseeing the closure, the painful closure I know for people who lived in Waltham, of Waltham Hospital, but then sort of recreating the hospital campus into what is now pretty vibrant. Commissioner of Mental Health. All those periods really helped me understand the vast needs of people, whether it's mental health, public health, developmental disabilities, people who rely on public service to help them get the services and supports they need to be healthy and independent and have resilience. I mean, that's really what I see about public service is honoring taxpayers' dollars and maximizing them to the best benefit for recipients and for the public to have confidence in what we do.
Now, in looking back at that very difficult time, I remember you played a very important role, and other state officials did too, in allowing Waltham to have every single opportunity that we could to give Waltham Hospital a chance. And that was what was done, and it wasn't meant to be. But as a result of all the work that many of us did together, we do still have an excellent, part of Children's Hospital, right, located in Waltham, and also an urgent care facility from Newton Wellesley Hospital. So, and also I think a lot of the, some of the money from the hospital went to provide other healthcare services in the city,
Right.
in Waltham.
Yep.
Correct me if I'm wrong, but I think is it 1 in 4 Massachusetts residents that is either directly affected by an agency in your secretariat?
Yes, it is Health and Human Services touches the lives of 1 in 4 residents of the Commonwealth of Massachusetts, often through Medicaid, or as we call it, Mass Health, which is insurance for people who are poor and can't afford commercial insurance. So Mass Health is our largest part of Health and Human Services, but SNAP benefits, or what people refer to as food stamps, touches thousands of individuals across the Commonwealth, as well as, I'm responsible for the Department of Children and Families, which, gets more than 70,000 reports of child abuse and neglect every year. If you imagine Fenway Park filled twice, that's the number of children that are reported abused or neglected in the Commonwealth of Massachusetts. But, so we're big, we're vast, and I take that public responsibility very, very seriously, as I think from our years of working together.
Definitely. The SNAP program, could you talk a little bit more about what that program is and what the state, under your leadership and Governor Baker's leadership, has been doing regarding that program?
So the SNAP benefit is a really very important basic food security program. So it provides food stamps for individuals to ensure that they have families, to make sure that they have food on their table, right? There's nothing, what's more basic than housing and food on your table. We ran into some difficulties. I inherited some difficulties in the food benefit program, and unfortunately, there seemed to be, I think, in a true effort to ensure to mitigate fraud and abuse in the food and stamp program, that the Commonwealth Serve was a little overzealous. So we, in the fall, the Commonwealth put a plan in place that actually unintentionally rejected a number of individuals who are eligible for food stamps off of from receiving the benefit, including elders, a number of very poor people who might have been got a job for a day or two, and then in this matching program sort of found themselves all of a sudden no longer eligible. I was completely horrified when I became secretary to find out that inadvertently people were being disenrolled from food stamp program. And we're talking about a lot of people. So what I did was, I didn't exactly know what was wrong, but I knew it was not working the way we intended. So I temporarily halted one of the match programs to just sort of hit the pause button, if you would, appointed a really terrific commissioner of the Department of Transitional Assistance, and he is working his way through the issues, has worked with the food banks and of the many advocates, with legislators, and I think the noise has calmed down, but more important, people are getting the food stamps.
I was just going to say, it's one of those things where if you're not hearing about it, it's probably working a lot better, right? And it's only when the system fails that all of a sudden we hear of all these horror stories of people perhaps getting the benefit that don't deserve it, and others, as you say, getting it, not getting it, that
who need it,
and it's designed for just to help them to get lifted up a little bit and often on their own.
Right.
So I know we haven't been hearing about the program in the news, so it is, from what I can tell you, you and your administration is doing a good job in that area.
Well, again, I hope people will see in fixing a problem like that is that I will sit at the table, I will listen to what the issues are, and if there's a problem, I'm the first one to say it's a problem. We'll fix it in the short run, and then find the long-term solution. Right. So I think we have rebalanced the SNAP program.
the state budget, I'm on the Ways and Means Committee, and we just recently finished the budget. And there's always matters that everyone, including myself, don't like, but by and large, it was a pretty good budget. And I have to say, I think the governor, the way he worked with the legislature was really, he did a real good job of that, and stayed away from taking any shots, that partisan shots that, it's obviously it's not his style, and I think it benefits all of us, including him and the public. And that things that I've seen in the past, perhaps from others. And so I was very impressed by his role in that regard, and also Lieutenant Governor Karen Polito, who I came into the House with. But with that said, could you talk a little bit about your experience with the budget and released this last month? And I'm sure we can never provide enough tools to do all the things that you think need to be done, but maybe you could talk a little bit about what resources you did receive in the state budget to do the jobs that you need to do.
Well, I do think this administration very much wants to work very closely with the legislature, and I think we saw that in this budget. All three budgets, I've been involved, like you have, with state budgets for many years. In fact, I probably have more years of working with the state budgets than you. Yeah. And what was remarkable was how close not just the bottom lines were, but the major priorities. Not within my domain, right, but fixing the T. Wherever you come down on how it should happen, right, but a commitment that the T was an issue we needed to fix.
Right.
A real commitment from the administration that the growth of mass health was on an unsustainable path. It's been growing at double-digit percentages, 15% from one year to the next, and we made a real commitment. This is where I'm a social worker, so I would come back. One of the reasons I wanted to come back to public service was, could we maintain benefits and yet come up with a different way to structure the Medicaid program to meet the need and to reduce spending? And with the legislature's help in this budget, we actually have, I'm not going to say we curbed the spending, but we're starting to trend it in the right direction, so that the growth of the Medicaid program for the first time is under double digits. So it's about 5.5% growth, whereas last year it was on a 16% growth trend, which is just, we can't sustain that because it does crowd out other very important initiatives that both the legislature has and the administration has. We protected, not only do we protect child welfare funding, it actually grows in this budget in order to add more social workers, in order to help keep kids safe. And again, that was working closely with the legislature. And truly, thank you for your support in the opioid crisis. A priority of the administration, priority of the legislature, the funding provided increases our efforts to really turn the tide in the opioid crisis. So I'm pretty pleased.
Yeah, thank you. And you were just talking a little bit about mass health, and I think people are more familiar with that term of mass health, and whether them themselves or someone, a loved one of theirs, it gets in a position where they need assistance. And obviously, it's another program that was ballooning out of control, and getting to the point where people that could use the program weren't going to be able to use it if the costs were escalating too high. You've talked a lot about, during your administration, a lot about integrating physical care and behavioral care. And could you talk a little bit about what that means?
Sure. So mental illness is an issue I know very well, both personally and professionally. I've never shied away from the fact that the illness has affected 3 generations of my family. My mom died from her mental illness. I have a niece with schizoaffective illness, and one of my sisters from very profound clinical depression. So I've seen the impact of mental illness on their lives and the impact on our family. And I've seen one of my families get not good health care in another state when her primary care doctor really didn't understand how her mental illness was affecting her physical health care. And honestly, I've been involved in mental illness for so long. If I believe in integration of behavioral and physical health care, if for no other reason that the segregation of the systems hasn't worked really well for people with mental illnesses. But when you think about it, it's, our primary care doctors are in a really good place to help people with light mental illnesses like a slight depression, or just to ask the questions and then refer you to treatment. Mm-hmm. So integration for me is along a continuum. So you could get really good care in your primary care doctors, or you might need to see a specialist. But we need to have primary care understand enough about mental health conditions and addictions so that they can really diagnose someone or say, I need to refer you to someone, as well as we need folks in the behavioral health side to understand that perhaps if you're gaining a little weight or your hypertension might be a side effect to the medications you're on.
Me now.
No, of course not. But really, when you think about it, I don't know how you can treat some part of a person but not understand what's affecting the rest of them. Mm. So I've just, also, the reality is that people with serious mental illnesses cost the system 2.5 times more than someone with a physical health care because of the fact that they have underlying medical conditions. They're not being treated.
Right.
So it's just, to me, it's just about time that we take what have been two segregated systems and put them together so that individuals get the care that they need, their families are supported, and we can probably decrease stigma as a result as well.
Exactly, and that's obviously a big part of the problem.
Right.
You mentioned the opioids epidemic and just that whole problem, and I was sharing with you before we came on air that recently in Waltham I started a drug task force. Essentially, I don't feel like we're going to be able to solve the problem. That's not the intent of it, but it's just to put all the minds together that different professionals or people that care in the community, whether it's police or folks in healthcare or people that were directly affected or their family members, which I'm one, and together in a room to try to start to come up with some ideas on how to help our community deal with this serious issue. And I know under Governor Baker's direction, the state just came out with some real good recommendations, and you were a pivotal player on that state task force. So if you could, and hopefully we could fit into your schedule. You agreed to come out to Waltham and talk more directly with the folks about what we as a community could do, and I'm looking forward to hearing those ideas about best practices and so forth. But maybe if you can just talk about the task force recommendations that Governor Baker came up with, it would be great.
So it was a privilege to chair the governor's working group on opioids. It was heartbreaking. We held 4 public listening sessions, hearing directly from communities, directly from family members. And one of those unbelievably poignant moments is when you hear a family gets up and says, my son, my daughter, whoever their family member is, we're a good family. And it's, I wanted to say, of course you're a good family. This addiction has nothing to do with, your family. It's an illness. And one of the real game changers, I'm hoping, is that we stop seeing addictions as a moral failure or something that happened in the family, but as an illness, and we treat it as the disease that it is, which is a chronic disease, and it's a chronic relapsing disease that someone who starts treatment may not successfully complete the first round of treatment, but that's not the person's failure. That is the power of this addiction, and that we provide prevention, intervention, treatment, and recovery along a continuum so that the individual gets the treatment they need to recover, and you can recover from addictions, and their family gets the support. The stigma around addictions, as I think you know, is so profound. And we've incarcerated people rather than, and this is not blaming police, this is not blaming courts, but we didn't create the treatment system to bring people in, so families have to go to court to ask for an involuntary treatment, a Section 35 as people refer to it. And what I want to do is, I'll leave the courts in that, but I want to be able to increase the access through the treatment side. It was heartbreaking to hear families say, my son, my daughter, 5, 10 hospitalizations, didn't stick, and then ended up in jail. And they were grateful they were in jail because they were safe. We've focused a lot of our work on the prescription drugs, opioids, which is clearly a gateway to heroin. And it's not the only gateway to heroin, but it's very clear that the misuse of prescription drugs, very powerful, can be, provide healing for people, and incredibly potent for misuse. So we're focusing on prescribing practices of physicians and other prescribers. We are improving the prescription monitoring program that everyone has heard about that doesn't really help doctors with treatment, but we're really going to extend the treatment options available for people in the community, and working with the legislature. I'm grateful for the support from the legislature and the funding to really extend both opioid-based treatment for people, recovery, and really funds for community groups, because the state can do state funding and state law, but it's really going to be from communities that come together to say, these are the needs we see in our community. What works in Waltham, it may not work in Worcester, and vice versa. So we really need to help Waltham nurture its own response. So I look forward to coming out to Waltham and talking to your group.
Well, it's great that for people who have been arguing for years, a lot of people in the legislature, Marty Walsh being one, of greater resources, and I have to say Governor Baker heeded that call, that Governor Patrick at the end of his tenure was doing so as well, and then I think went above and beyond and addressing resources to the issue. And I also have to give credit to the media, Channel 5 in particular, this year, and I don't know what role the governor may or may not have had in that, but with their public service announcements about the crisis,
Stop addictions,
and how it affects all sorts of people, all different walks of life and different communities. And I'd have to say it's my own opinion. I'd say maybe not. Folks can't recover, but they get into recovery, and it's like that movie 50 First Dates. Yep. You wake up the next day, and it's very easily to forget. It's hard for people to understand, but it's your mind plays tricks on you, and it's easy to forget that you're addicted to drugs or alcohol. And it's something that folks have to work on every single day, even when they get to that state of recovery.
It's that's why I think if we can frame this as a disease and a chronic disease, that someone's always in recovery, we're also giving people a message of hope. And as I remind folks that if you relapse, it's not a failure. It means that either the treatment wasn't right, you weren't quite ready, and we stay with you. And we don't say, you're done. I think that is one of the changes in this. Thank you for mentioning the Stop Addictions public awareness campaign. We repurposed actually some federal block grant dollars and partnered with Channel 5 for that public awareness campaign. We'll be continuing that with some of our federal block grant dollars. Again, just trying to increase people's understanding and awareness. The website, the phone number that's part of that campaign has been used heavily since we announced it.
We just have a couple of minutes left, but one area that I think, from my experience, you know, folks in healthcare are just amazing people, you know, doctors, nurses, and so forth. But by and large, I don't think the vast majority fully understand addiction, and that's perhaps that's just part of the problem of folks getting addicted to painkillers, and then when that becomes too expensive or too difficult to get their hands on, they go to that cheaper high. Ironically, it's worse, but the heroin,
Right.
And that can be deadly in a second.
Yep. There's no question that we need to increase the education of our prescribers, doctors, nurses. They're incredible healers. I'm not sure anyone really had understood how powerful the medications have been. And so what are the alternatives to opioids? Or can we have fewer opioids when you have like a surgery or something? Instead of a month's supply, maybe it's 3 days. If you're still in pain in 3 days, you have to go back to the doctor.
Right.
So, you know, the good news is the Massachusetts Medical Society, which is located in Waltham, I believe.
It is the center of the
You
universe.
are the center of the world.
Right.
Mass Medical Society has absolutely stepped up to partner with government and others to really help educate doctors around both the positive and the negative aspects of opioids. So I think working together, I think we can start to turn the trend of what has been a terrible epidemic in the Commonwealth of Massachusetts.
Well, thank you very much. I honestly believe in my tenure in state and local government, there's a handful of people that I really admire and respect, and you're one of them. And I'm so glad that you came back into public service and working for us, for our tax dollars, because you are doing a great job. And thank you so much for taking the time to come on my show.
Thank you, and I look forward to seeing you in Waltham.
All right, great.
Thank you.